and welcome to today's edition of About Health. Our special guest today is Dr. Joy Foster. She's a radiologist who specializes in diagnostic imaging. She'll tell us what that's all about in just a minute, but as importantly, she's the president of the Sinkler Medical Association, the local affiliate of the National Medical Association, the Organization of African American Physicians. Dr. Foster, thank you for taking the time.
Thank you.
What is a diagnostic radiologist?
Diagnostic imaging is where I make a diagnosis. I actually interpret. I look at the CAT scan, I look at the MRI, the X-ray, or the mammogram, and then tell usually the physician what's going on with the patient.
All right, tell us a little bit about the Sinkler Medical Association and your experience and involvement with it.
When I did join, the reason that I joined was because I sensed that the doctors that were members had the same passion that I did about giving back to the community and standing for something bigger than the community that we know that the community, not only are the patients that we serve, but also the community of physicians that we are a part of, that we're all striving for a bigger goal. So that was just something that I just wanted to be a part of.
Why a separate medical association for African American physicians?
There is still, I believe, a purpose and a reason so that we have a sense of camaraderie, that there's still a healthcare disparity in this country, even though we have an African American president, and that it's important that physicians have a forum where they can come together and support each other and also support the community that they serve.
And looking at the history of Sinkler Miller, it arose out of a period of time when there was clear discrimination in terms of not being able to go to hospitals and not being able accepted into medical schools and special programs. Are things better for African Americans?
I think things are better, and we still have a way to go. If you look at, even if you look at from women physicians to their male counterparts, and there's still disparities in what doctors earn, and there are disparities even with the race of a physician. Actually, there was a member within our organization who went for an interview recently. We're talking in 2015, and he was asked, even though he had been invited for an interview, if he was in fact a physician. So there is a need for our organization in this day and time.
Sinkler Miller is a very distinguished history. Tell us about some of the things that you have done, and tell us about some of the things that you're doing now as principal programming or goals and objectives.
One of the things that our organization, what we're very proud of, is we host an annual fundraiser. And the reason we do that is because we are invested and we're committed to empowering the next generation of physicians. So we raise monies to give scholarships to young people that are going into healthcare, be it medicine or nursing.
Yeah, you're being relatively modest. I think in over 33 years, Sinkler Miller's probably given away over $1 million
That's correct.
worth of scholarship. And one of the functions of that, in addition to education, is to bring people back into the community or support. Have some of these students come back because if you look at the statistics nationally, the number of African American physicians is really kind of dwindling. Have you had success in bringing them back in the community and supporting the efforts of not just Sinkler Miller, but the African American community?
Oh, absolutely. We have members currently that receive scholarships. Back in the day, there was one woman in particular who her parents actually sent her over here to live with a family. She's from Africa, and I don't remember the exact country. I believe it was Nigeria, but I'm not positive. All that to say, she came over here on her own without any support, even though these were family members. In her mind, she didn't have the support like she would with her own parents. She graduated. She was not supported at her graduation. She's now in her third year of medical school, and she has said if it weren't for the scholarship that she received from Sinkler Miller, she wouldn't be here. Now, of course, she had a lot to do with where she is, But that kind of individual, and where there are other stories where those young students, young medical students, will come back and are coming back.
Well, thank you, Dr. Foster, for sharing the story, an evolving story of Sinkler Miller. Thank you for taking the time.
Thank you very much for having me.
That ends this edition of About